Well, hey, friends, welcome back to the podcast. Listen, today we are going to talk about, of course, Breast Health Awareness Month. I don't like to use the C word in there because I kind of don't believe in all that. Not saying that it's not a thing, but just the way that we talk about it or we almost celebrate this as part of the medical machinery that we have. We're going to find a cure for cancer when we know that cancer is becoming more and more common. And I think that the medical establishment pushes for this cure that I think is probably elusive because it's the cancer machine, right? That we're feeding into without there ever being a possibility of a cure because there's too many people that would lose their job, lose their funding, all the things. So I'm a little passionate about this. I'm going to tell you a story. I don't think I've ever told this story before about something that happened when my oldest daughter had bone cancer. This was probably in 1994, I would say. So I was in my early 30s and she was in active chemotherapy. And what happens in chemotherapy is, in her case, sometimes the type of chemotherapy that they were giving her because the cancer was so aggressive, they were giving her this certain type that they had to monitor it constantly. And there was a risk of, heart damage with one of the drugs, et cetera. So anyway, all that to say, we ended up like, I don't know, within a week or something after chemotherapy, she spiked a fever. It's called fever FNN or fever and neutropenia. And so they said, if she gets a fever, you've got to come straight back to the hospital. So I call the hospital. We go in, they admit her, and they look at her and they say, well, let's just give this some time. We're going to call in an antibiotic for you. I said, okay, great. So the hospital's an hour away. So I cart all my little, 3 kids back in the car, back home we go. And I have to go to this little pharmacy. Now, this is back in the 90s when a couple of things. Number one, we didn't have like big, CVS and Rite Aid, and we didn't have all of that back then, at least not in the little town that I lived in. And this little town had a population of about, 10,000 people. And so we didn't have that, but we had a little local family-owned pharmacy in the town, and everybody went there to that particular little pharmacy if you needed something. And they said, "What pharmacy do you want?" And so I told them, and they said, "Well, we'll call in the prescription that she needs," because they had cultured the bacteria, and they said, "This is what we need." Okay, fine. So, I'm in the middle of this medical machine trying to save her life, but I'm also waking up to the fact that there are other alternatives out there that could possibly be better alternatives. Now, this is a kind of a new language for me in a way because I didn't feel like I had another option but to go the medical route and do chemotherapy. However, at the same time, I was doing some alternative things that they would laugh at me about in the hospital. I could hear them in the middle of the night when she was admitted for a couple weeks at a time. I could hear the nurses in the nurses station talking smack about me and saying, well, that Rhonda, she's trying this or that thing. She thinks that's going to cure her kid. Ha ha ha. She doesn't know she's going to die. It was just horrible. And so I was just doing everything I thought I knew I needed to do. And so when they said, go get this antibiotic, I said, okay. So I get all the way hour drive home, pull up in front of the pharmacy, leave the kids in the car, and I run in and they said, "Oh, well, we can fill it partially, but we only have 3 of the pills." And I said, "What? You only have 3?" And they said, "Oh, well, yeah, we don't keep all of this one on hand, but we can order more and we'll have more in tomorrow. So you'll have enough for the course, whatever it was, 10 days or something like that." And I said, okay. Now, before I tell you the rest of the story, you also have to know that back at this period of time, insurance then was not like it is now. For those of you that are old like me, you'll remember the days that we had, insurance covered 80% and we covered 20%, literally out of pocket. Me, the parent of the patient, I was responsible for 20% and the insurance paid 80. With prescriptions, you had this situation where you had to pay for the prescription, but then you could submit it and then they would reimburse you, which to some degree can happen today too for some. So I said, okay, great. Well, let me just pay for the prescription. And I can't remember now, but the prescription was like at the time, now this is in the like early 90s. At the time, the prescription was something like $500 or $700 or something. Back then, that was just a ridiculous amount of money. And I literally did not have the money. I didn't have the money for the prescription. And my heart just sank because I knew that was the only way to get that prescription. Like there was no like, oh, just bill my insurance. I literally had to pay for it. And they wouldn't even let me pay like half so I could get the half of the pills because the doctor said, listen, she's got to get this prescription. She's got a nasty whatever, gram, blah, blah, blah. And she's going to die if we don't get this, fear, fear, fear. So here I am, young mom in my 30s, trying to take care of my baby, and I don't have the money to take care of her. I literally don't have it. So I said, okay, well, being a resourceful person, I thought, all right, well, I'm just going to figure it out. So I said, well, I'm going to call around. I called Children's Hospital. Can you help me? No. I called Shriners Hospital. Can you help me? I called St. Jude's. Can you help me? No. I even called like Easter Seals and I called it everywhere I could think of. And I could not get anyone to help me. And the internet was not what it is now either. And so it was 3 days and she had not had this antibiotic. So I finally, with, my tail between my legs, I have to call the doctor's office and tell them that I haven't started this prescription yet. And when I called and told them that, they about had a fit. They just were like, "What are you kidding? What? You have what? Oh my gosh, hang on." And they put me on hold, said, "I'll be right back. This is not okay." And I said, "What do you want me to do? I don't have the money to pay for this. So what do you want me to do?" And so they come back on and they said, "Okay, we called in another one." And I said, "Is this one gonna be less than the last one?" And they said, "Yes, it will be less." And I said, "A lot less?" "Yes." Okay. So I leave the kids at home. I run down to the pharmacy about a mile away. I walk in. They'd already called it in. They've got the script, and I paid $17 for it and walked out with the antibiotics. And that was the moment for me that I really saw firsthand the medical machine. And when I asked the pharmacist why the $17 one would work, because I'm now like, okay, is this even going to work? They said I had to have the first one. And they said, oh, no, that's just the new drug. It's a little bit more specific. This one's more broad, but this one will get it too. I was actually surprised they didn't prescribe this one to you just because of the cost. Yeah. 3 days, no antibiotic. What if she had died? You know, that's just one story, but I saw the underbelly of this, cancer machine. And that was when I realized that in my heart, I was gonna do everything I could to educate kind of against that and start talking about alternative methods, and that was really what led me into what I do now as a, clinician and as a, outspoken person about the power of food and diet and, supplements that contain those right food-based nutrients. So through the years, I started to get a lot more cancer patients, and I started to see the same kind of machinery at work, and I think the breast cancer situation is no different. You probably all would agree with me on this. So when we think about breast cancer and patients that we deal with, women, there are now so many screening tools available and so many things that we can do. And the big one is mammography. And we all know about the risks and dangers of mammography. It's prohibited to be used in certain countries, European countries. It actually will cause cancer because of the compression and the condensed radiation in the breast tissue. There's a lot of very big risks. Also, there's a lot of false positives. And so they'll, scare women. They give them information. Oh, you might have breast cancer. Now her nervous system's all dysregulated. Her stress goes up. And now she's scarred or marked by this trauma. And then they go, oh, no, it wasn't. Was just joking. Like it wasn't really. We cleared that up. But now she's nervous. I mean, you can see that it really does affect women. So whenever October rolls around, and I'm just literally, I have no notes. I'm just talking from my heart. When October rolls around, I always kind of get a lump in my throat for a variety of reasons. One is because they don't want to find a cure. And for those women that have had breast cancer, my sister passed away from breast cancer 2 years ago. So this hits home for me, but I saw it when she was going through it too. They gave her the most aggressive chemotherapy for her type of breast cancer at the start, and it didn't work. And the breast cancer came back quickly. And they said, okay, well, let's try something else. And that one failed. Let's try something else. There's a lot of incentives for these oncologists to prescribe the cancer medications, and it's just a dark industry. It's very dark. And my sister ended up with 6 different types of chemotherapy, and she died. And I knew that that was going to happen because it just kept weakening her, weakening her, weakening her, weakening her. She left behind 6 kids and her very first grandbaby. It's heartbreaking, and it makes me really angry. So when October rolls around, I don't know that I would say I'm angry at it, but I would say that, yeah, maybe I am angry. Maybe I kind of am angry because it took my sister, but how many other millions of women's lives has it taken? And it's because they don't want to find a cure. There's so much money that goes into breast cancer research in all of these years. You kidding me? They can't find anything. But yet on our side of the world, on our side of the fence, from our perspective, we know all the things. We can help. We know it's diet. We know it's these endocrine disrupting chemicals. We know it's nutritional deficiencies. We know it's exposure to toxins. We know it's a metabolic disease. We know all of these things. If you fix that and you catch it early, there is no reason why the body will not right itself, because it wants to right itself. It wants to be healthy. It wants to maintain a state of homeostasis. But yet so many women, like, I'm having a hot flash just talking about this. Like, it's just bothers me so much because so many women get stuck or caught in this, I don't know, in the web, I guess, of like, I have breast cancer, so I better go to my doctor. And then the fear comes in because it's a machine and they need to keep us trapped in this machine. And they don't ever talk about male breast cancer, but that's on the rise as well. So I guess this is what I want to say. This month, we certainly want to honor and respect the women that we know that have either passed and lost their lives, like my sister, from breast cancer. And we want to honor those that have been through the medical machine and survived, because they're winners. They're definitely winners. But I was thinking that I was going to get a little bit more like clinical with you today. I've been thinking about doing this podcast and I really didn't want to do it because I think I really kind of am angry. But I was reading some research and digging and looking, and I read one paper and it said the outcomes and the strategies and the methods that we have for treating breast cancer right now are really not very good. And I'm thinking, well, no, duh. But what's happened to all that money y'all been getting? What's that all about? So there are a few things to end this on a happier note. There are a few things that I want to just bring to your attention that you can consider this month, even talking about breast cancer with your patients. And one of those things is a mushroom. And you probably all know what I'm going to say, but it has a lot of well-researched, a lot of data behind it, supporting it. And that is turkey tail. Now, I get all of my mushrooms from Real Mushrooms. It is not a practitioner-only brand. Patients can get them online. But the turkey tail is not the only mushroom that has been shown to be anti-inflammatory, this, that, and the other thing. Big long list, because they're multifactorial, just like the herbs are, right? They have multiple points of action. But turkey tail is one that is especially great for breast cancer. So that being said, why would we not put all of our women knowing, and I'm going to talk about risk factors in a minute, but knowing that we are like in this soup of risk factors for breast cancer, whether man-made created or not, that's a whole nother conspiracy topic for another day. But we know that we're living in this soup that creates and produces a lot of these types of cancer, specifically breast cancer. But why would we not just have women take turkey tail on a maintenance? It just seems to make sense, right? I take it every day. And there's a product by Real Mushrooms, and I get no kickback from them. Like, they don't even know I'm talking about this. I will, tag them in the show notes so they know. There's a product from Real Mushrooms that's called 5 Defenders, and it literally has all of the herbs in it that are known to help protect against breast cancer. Now, they can't state that on their website, and I'm not affiliated with them in any way, and I'm not getting any kickback. This is not a paid advertisement. This is just my own experience. But that 5 Defenders product, they list it as being an immune support product, but it's got turkey tail and chaga and maitake and shiitake. I think there's one other one in there. But they're great, really great. So if you gave this to your female patients and you said, look, I just need you to take 2 a day, 4 a day, ongoing, this is going to protect you. Like my 2 daughters, I have both of them taking this. I'm like, girls, you just got to take this. This is going to protect your girls, your 2 twins. You got to just take this ongoing, because we live in this soup of toxicity and chemicals that are giving rise to all of this increase in breast cancer. So I listened to an interview not long ago, and it was a famous doctor that you would recognize the name. And he said cancers are purely a metabolic disease. And my first thought was, well, I don't disagree with that. But I also don't know that I totally agree with it either. But I suppose if you extrapolate it out far enough, you could say that that is true. But here was my kind of objection to that thought is that we know that the environmental toxins that we're exposed to are a huge contributor to breast cancer. And those toxins, many of them are endocrine disruptors, which by default would then make cancer, you could call it possibly a metabolic disorder. But we are bathed in this soup of these chemicals, and they are known to be cancer-causing chemicals from lipstick to makeup to body care to deodorant to sunscreens and hair products and all the things that women use, the girly girl things that we like. Then you throw in the chemicals in the house and the things on the clothes and sprays that they put on a brand new couch and the smell of the new car and the fertilizers on the lawn and the crap that they spray on our food. So that's my point of disagreement with the metabolic disorder is yes, I would agree with that. But I also think that there's a point that we need to really be educating our female patients about what are the things that you can do in your life that are going to mitigate your risk. Because what if you are, and I mean, I don't know that I would say this to them, but what if you are one of those women that don't fare well? You don't end up being one of the survivors. Would all of the prep work have been worth saving your life? And I think everybody would say yes, right? Not a conversation that we want to have, but the establishment, I'll say, is using fear as a manipulator in many cases. And sometimes wrongly so. Like there's not even a positive diagnosis because a mammogram has misdiagnosed. Much better to do like thermography combined with 3D ultrasound. And conventional medicine is going to, say thermography doesn't work, blah, blah, blah. But there's a lot of studies that show that it does. Everything misses something. There's not one test that's 100%. But I can tell you what, thermography with 3D ultrasound is as good, if not better, than a mammogram. So you pair those two together, you're going to get a large percentage of them. You're going to catch them, and you're also going to find where the woman may be kind of running up to or being like almost a precancerous state where you're starting to see estrogen patterns in the breast tissue, et cetera. I did an interview with my daughter, actually, Ashley Houchin. I will put that in the show notes so you can go back and listen to it, but she is a thermographer and she does a lot of breast thermography and she talks very, very intelligently about it, much more so than I am. She's just really educated in that field. So I'll put that in the show notes. You can go back and listen to that podcast if you'd like about thermography. But I think we have to just educate our patients. So the 5 Defenders product from Real Mushrooms, and or you could just get straight turkey tail if you wanted to do that. It comes in a powder or a capsule. Another thing that you can always do is you can think about supporting the local tissue. Now, breast tissue is rich in estrogen receptors. So anything that's going to be an estrogen mimicker is going to be a problem. And also, iodine is also rich in the breast tissue. Now, I'm not saying go put the patient on iodine, but you might want to look at T4, total T4, as an indicator of what's happening, how much T4 is the thyroid producing. Breast tissue has iodine receptors, which means it does produce some thyroid precursors, thyroid hormone precursors. So I would maybe consider doing even a halogen test. You could do like a urine type test where you're looking at iodine and you could see what the halogen levels are because those halogen levels will block iodine receptors. So you might want to look at that. You may want to think about doing some kind of chemical detox. You may want to look at like making sure that the liver is really working. When I was in my first years in my master's program, I remember years ago that the professor said every cancer patient is a liver patient. I've never forgotten that. Every cancer patient is a liver patient. And so by saying that, when we have liver toxicity and the liver can't clear through phase 1 and phase 2 what it needs to clear, then we're going to get a buildup of those things that otherwise the body would be like, yeah, no, we need to get this out of here. And it can't because the liver's not doing its job. It's getting congested. We've got too many of those intermediary metabolites that are dangerous, toxic, and harmful because phase 2 is not working. So, there's lots of things that you can do with women to help support them in this way as they get a little bit older and women start thinking about like as they age, we start thinking about bone density, we start thinking about longevity and life. Like, for me, I'm 62. I'm in the last like trimester, I'll call it, of my life. Like I'm there. And so I'm always thinking like, well, how do I optimize what I have? If I wake up in the morning and my joints are a little bit stiff, I have to think, okay, what did I do yesterday and why does it feel this way and what's going on and do I need to do something different and what happened and is it calcium precipitating out in the joints? And you start to get on a little bit higher alert, and women are like that as we age, and even women in their, reproductive years, any little breast thing and they're like, whoop, oh my gosh, is it breast cancer? So teaching them how to do a really thorough breast exam, create a resource in your practice and just give it to women. Give them a list of YouTube videos to watch or whatever you're going to do, but show them, give them the resources to be able to do a good breast exam. And, it's education is where we're going to win this war. It's education. It's also making sure that certainly their metabolic systems are in good working order. Blood glucose is good, inflammation is down, etc. We want to make sure that all of that is all working well too. But I think that we have to be on the offensive here. And the Breast Cancer Awareness Month makes me feel like I think that it's almost a defensive thing. It's like, oh, you have breast cancer? Well, we're here to help. No, I'm not here for your help. I don't want your help. I've seen how your help helps and your help doesn't help. But our kind of help is going to help because we can help the patients be on the proactive side. We can help them add things into their routine, their supplement routine. We can help them with their diet. We can talk about non-toxic body products. What things are you putting on your skin? Body lotions, makeup, lipsticks, like what are the things that you're doing that are going to maybe push you a little bit more towards the higher risk category versus let's just make those little subtle changes and see if we can give you a little bit more protection sooner than later so you don't have to cross that bridge later on. So, unscripted today. I didn't have a plan. I just had a passion. So, yeah, this whole breast cancer thing. I'm sorry. I don't like it that people have died. And it makes me I think I am angry. I'm angry at the machine, I think. At the economic machine. They needed to make the money off of the drug that they called in for my daughter. That was just a new drug, and so the doctor was at the back and then probably getting a kickback on that, but yet I couldn't afford it, and it put my child's life at risk, and she was fine, and the cheap antibiotic worked fine. So why? Why not just do that? Because this whole thing is a machine, and they can't find a cure for cancer. They can't because there's too much money, too many people. I mean, the American Cancer Society would basically go away. But we know that there are things like benbendazole and hydroxychloroquine and ivermectin and apricot seeds and, milk thistle for the liver. Like there's so many things that we can do to intervene, support, provide that kind of care for our patients that are going to help get them out of that tricky spot where they're either at risk or they're maybe currently going through it. And I don't think that we're wrong to do that. We're just providing a different option. And when you can offer that option in a way that is compelling and honest, and, we can't offer any guarantees, but certainly I can say, look, here's another option. Like I know someone right now that is dealing with cancer and it's recurring and she's not interested in anything I have to say. She's like, nope, I'm going to just keep going to the doctor. And I go, okay. And, it may not work out well for her, but that's not mine to worry about. My responsibility is if I have a life ring, I have the things that will help get you to safety. I have a moral obligation to share it, I believe. And I think you do too. When we know something, we at least have to share it and give them the ability to make the choice. And then the person gets to make the choice. I don't want someone shoving something down my throat. I want to be able to have autonomy and agency to be able to make my own choice. But it really does help me to make the best choice for me when I have the information in front of me. So I have option A, option B, option C. And then I can make the choice that feels right for me. So for us on the clinical side, on the practitioner side, I think providing information just gives them one of those three options, right? You just say, here's an option to consider. Some people will choose it and some people won't, and it's okay. But we have to give them the life ring. We have to be able to provide the information. And I think that's the point of what I just wanted to share today is, don't be silent on this. Don't be afraid to tell your female patients and educate them about what the options are and what the risks are. Like even to, having a mammogram, like find the local people in your area that do thermography and ultrasound. Figure that out for them, make it easier for them, and then give them that option. Don't get in that mammogram thing. Oh, we have to do your screening. They used to be annual, and then they cut it to every 2 years because they were finding that cancer rates were going up. The more mammograms you do, the higher your risk of cancer. Tell me that's not a scam. Tell me that's not wrong on every level. It 100% is. So if we've got that life ring, we've got options for them. Then let's throw the life ring out. Let's give them the choice. Allow them to be able to have information that they can make a good choice for them. Not what we want, what's good for them. And then we know that we gave them the life ring. Whether they choose it, it's okay. If you don't, fine. I'm still here. I love you so much. But that's our responsibility. I wish now, like, I've kind of made peace with my sister. I don't like it. And I think about her every day like she was my person. And so, yeah, I kinda get angry about it because I think, I think they killed her. But she didn't always make the right choices either. So, there's the give and take, I suppose. But anyway, that's all my ranting for today. Thank you for letting me just go off the cuff. Thank you for listening. I love you. I so love my people. I love these practitioners that have come into my world, into my life that make me a better person. You share your information like in Clinical Academy, and we meet for these twice a month live calls. And, we just talk about what's happening and what's going on and what do you do? And like we work together, iron sharpens iron. Like together, we've got this. And I just want you to know how much I appreciate you. I appreciate your kind words. I appreciate that you all listen. And I really do love doing this for you. But so thank you today from the bottom of my heart for just letting me go a little bit rogue on you today and just kind of share from my heart. And I hope that it made you think, maybe give you some ideas about how you can connect with your patients a little bit better about this topic of breast cancer and Breast Health Awareness Month. I think we should rename it. All right, I'm going to let you go. I'm done ranting and I'm done sharing. I'll be back next week with another podcast. Take care. See you then.